Aloha kako. Welcome and good evening. My name is James Eustace, and I'm the president of the Waimea Community Association. Thank you to those joining us online tonight for our regular monthly Waimea Community Association town meeting. Tonight, we'll be hearing important updates relating to the challenges our community faces during this time. I encourage you to follow, like, and subscribe the Waimea Community Association on Facebook, Instagram, and YouTube. You may also find relevant information and resources on our website at waimeatown.org. We strive to keep our accounts active and up to date. At this point, I would like to recognize the Waimea Community Association board members, our Vice President, Michael Donnelly, our Treasurer, Louis Dubois, our Secretary, Frankie Pang, our Assistant Secretary, Patty Cook, and our Directors, Nancy Carr Smith, Riley Smith, Lonnie Olson Chong, David Greenwell, and Llewellyn Kumalai. The Waimea Community Association Board is grateful for the support shown by the community to hold virtual town meetings. During the month of June, we held a series of virtual forums highlighting the candidates seeking election in Hawaii County. And in July, we continued our monthly town meetings in this virtual setting to hear about the plans and policies being implemented by our Waimea schools, public, charter, and independent. We were also grateful to have Representative David Tarnish join us and provide a detailed update about the close of the legislative session, the challenges being faced by the state legislature, and the numerous bills and actions taken that will support our communities. Thank you all for your interest in joining these live past events and evenings, and for viewing and sharing these recordings. You are welcome to revisit these videos on the WCA Facebook page and on our YouTube channel. The Waimea Community Association is a nonprofit organization that strives to promote open participation by all of the Waimea community, develop leadership, and support the smart growth of the region. If you would like to support the work we have done and help continue our effort in connecting with our community, you are more than welcome to donate or join as a member. If this is something that interests you and you would like to receive more information, please email us at waimeacommunityassociation@gmail.com or visit our website, waimeatown.org, and submit a contact us form. As mentioned, tonight we'll be hearing some important updates about our impact on our community, especially during this time of COVID-19. We'll begin this evening by spending some time with Lieutenant Governor Dr. Josh Green as he joins us again to connect with our communities and share his knowledge and experience during this difficult time. We will then hear a few community policing updates from our South Kohala District Police Captain Sherry Bird. Following a brief announcement regarding the state primary election, we will then have an opportunity to learn about a number of groups and organizations that have been striving to support our families and communities. We will be hearing from Ann Lum with the Annunciation Catholic Church Food Pantry, Nancy Carr Smith with the Big Island Giving Tree, Kristin Frost-Albrecht with Hawaiʻi Food Basket, Laurie Ainslie with Kokua Christian Ministries Food Pantry, Tim Bostock with Waimea Community Meal at St. James, Elly Mercer with Waimea Preservation Association and their Grab and Go Meal Program, Lorie Farrell with the Bridges Program, and Leslie Kissner with Farm to Families. This evening, we are grateful to be joined by many strong, community-minded leaders who have and are striving to support and lift up the communities they hold dear. At this time, I would like to start off our virtual meeting by welcoming Lieutenant Governor Dr. Josh Green to share with us a status report and impart some of his wisdom. Lieutenant Governor, we are honored to have you join us again in an effort to connect with our communities across the state. If you have any questions for Lieutenant Governor, please share them in the live stream chat, and we will do our best to capture them and present your inquiries to the Lieutenant Governor shortly. Thank you to those who have submitted them questions previously. Lieutenant Governor, the floor is yours.
Great. Aloha, everyone. Hope everyone can hear me okay. Good to see you all. It's like being home, although I'm coming home on Saturday anyway, because I'm going to be on call this weekend. So it'll be great to be back. Let me just start by bringing people up to speed on where we are as a state. There were some significant changes that occurred in the last 2 or 3 hours from a policy standpoint, although most of them affect Oahu predominantly. But I want to share them all, and at least one order does definitely affect all of our state and the neighbor islands. But truthfully, we're all connected, and that's never been more evident than now when we have an infectious disease that we're able to spread quite quickly across the state. So thanks for bearing with me. We had 152 cases today. The initial report of 53 was incomplete because most of our tests hadn't come back yet. So consistently over the last now 7 to 10 days, we've had higher numbers, triple-digit numbers. That's a reflection of large gatherings. Some spike has occurred in, I would say, indoor settings associated with funerals. I actually probably will share some experience I had today and yesterday with the Pacific Islander community. I've been having meetings with the leadership from across the state, from the Native Hawaiian and Pacific Islander community, and it was quite eye-opening. But first, let's just share where we are. With 152 cases today, that took us into relatively rarefied air for Hawaii. We're at 2,914 cases. We also had 2 fatalities in the last 24 hours, one very elderly gentleman and one elderly woman, both of whom had underlying health conditions, which has tended to be the concern when we have individuals in the hospital. Our hospital numbers have been gradually creeping up, and that's what prompted quite a lot of concern. When we reflect on the number of cases, I want to distinguish, however, between the neighbor islands and Oahu. About 98% of the cases for the last month have occurred on Oahu, and that's really a function of lots and lots of people coming together, plus the reality that in a city, there's just too many opportunities for people to be either on the bus. We used to complain about not having adequate bus routes on Big Island, but at this moment, it's probably preventing spread of coronavirus, as ironic as that may be. The challenges are statewide, though. So we had, like I said, 152 cases. I think what you guys often are most interested in from me is what's our healthcare capacity. And that is something that I constantly focus on because we can tend to weather the relatively asymptomatic cases in young people, but when our hospitals fill up, it becomes a challenge. Statewide, we have 244 intensive care unit beds. We have utilized, as of this morning, 130 of them. And we have 459 ventilators available if we have a surge in need for respiratory support. Only 68 are in use, which is about 15%. So that's been quite good. Although actually the perception has been that you had to ventilate people originally. Now a lot of people are getting by without needing a ventilator with other modalities of treatment, particularly steroids, remdesivir may be helping people. There's a lot that we're doing in the intensive care is a little different, mostly oxygen support. But when we look at the neighbor islands, especially Big Island, which is our home, I'd comment that we have right now no cases of COVID, to my knowledge, or as of this morning, in the hospital, in the intensive care unit, or on a ventilator. There may be some people for minor symptoms in regular hospital beds, but no one has been in critical condition for some time. And we've only reported 7 active cases as of the last 24 hours on Big Island, which is what will bring me to the one significant order that the mayor and the governor decided to enact, which was they do intend, in fact, it will be in force as of the 11th of August. Again, the 14-day travel quarantine if people travel between islands. I haven't clarified if people go between neighbor islands, like if you go from Big Island to Maui or Maui back to Big Island, in which case it doesn't make a lot of sense because there's almost no cases in either venue. That has to be clarified, but most often we go through Oahu and that ends up triggering the 14-day quarantine. But as of now, very little impact from the order other than that. I think we'll talk a little bit more, though, about what happens on Oahu because a lot of us have friends, family, sometimes are traveling to Oahu and so on, of course. In addition to the Big Island, 12 out of 24 of our ICU beds are in use, those are from individuals that have had other health problems, heart attacks or strokes or what have you. Only 10 out of 50 ventilators are in use. Maui's very similar. 14 of their ICU beds are filled out of 29, so almost exactly 50%. And Kauai is 5 out of 9. So it's interesting. It's kind of running at 50% most of the state. On Maui, 6 out of 28 ventilators are in use, and in Kauai, 0 out of 15. So you can see how it's quite different on the neighbor islands, particularly in very rural settings, and that's basically playing out consistently for us. However, we have been seeing a surge in need for hospitals beds on Oahu, and because of that, it does, in many cases, change how we are able to access healthcare for ourselves. What will happen is, for instance, Kaiser has been full for the last 2 days in the ICU, and Queens is opening up a second unit. If those facilities don't have accessible service, and we have someone that's very sick, we have a more difficult time transferring over from Waimea, Hawaii, Ka'u, wherever on Big Island. So that's something that we should reflect on. The other changes that occurred today as a result of this, and then I want to talk a little bit about what's going on with the disease, is on Oahu, effective Saturday, or midnight Friday going to Saturday, all beaches and beach parks are going to be closed for a month. And that's meant to decrease the spread in clusters. There have been massive gatherings every weekend and sometimes weekdays, all the way since 4th of July. And that's been suspicious as to the spread. However, it's not the full picture. Like I said, the Pacific Islander community, particularly those that are living in Kalihi, have been gathering, and there have been a lot of church gatherings. Funerals are a high, unfortunate risk for spread because people are grieving, and it's really virtually impossible to tell people not to embrace when they've lost someone, and that's how spread's occurring. So I saw someone ask the question, is that just Oahu? Yes. As of now, that's just Oahu. The orders for the neighbor islands wouldn't make any sense. We're going from, for a big picture, the neighbor islands, especially Big Islands, like in a yellow zone. It's not quite clear of disease, but the risk is very low right now, fortunately. That doesn't mean it can't change, but with the number of cases we have and the viral load, it's very low. Oahu was also in that category until today. It's going to now switch to the orange category, essentially, which means businesses will stay open. People can go out, but it will not. We will not be allowed to, gather at any venue. That's the distinction. Restaurants are still open. That was controversial. Exercise facilities. People on Oahu like to go to gyms a lot. It's a little bit different than we on the neighbor islands, where we're outdoors constantly and we have big open spaces. But that's been a concern. And then there has been just a lot of concern about bars, and the bars have been closed. The indoor gathering restrictions are down to 10 people for all of Oahu. And the goal is over the next 28 days to really flatten this number down so that we don't have this, very large scale public health surge constantly. Because if it's going on Oahu, it affects, number one, education policy to a large degree. We know that Department of Education is centralized, and centralized mostly on Oahu. Some of us have fought that over the years and asked for a little more autonomy for ourselves on the Big Island and on Maui and Kauai. But for now, that's the way it's been. And also, of course, travel to the state. That, I do believe, will be delayed, although the governor hasn't made an announcement about postponing. And that's a challenge. It's a challenge for many reasons, mostly economic, because travelers have not typically been our significant spreaders. It's been we in the community when we're with our friends and family, if we're unlucky to be positive. A lot more contact time. And so that's how this has been playing out. The travel quarantine will be for 2 weeks. People can still travel for essential work. And obviously, if you have a healthcare need or some other need to be with family, if someone, say, is sick or is at end of life, there's lots of reasons that you can get a travel exemption. And in that case, you write COVID exemption at hawaii.gov. And my recommendation to you and everyone on the call is to copy me on that letter to my email, which is josh.green@hawaii.gov, and I will comment on it if it's someone from a neighbor island, particularly from home, and they've made some kind of compelling argument. And all of those seem to be getting approved, which I guess is just a matter of paying a little extra attention to it. So if you do have that need, and it's a genuine need, just please copy me on it, and I'll kind of track it down and be happy to help. So that's kind of the overview. A couple other things I wanted to share. With this surge, we now have 1,400 active cases, for argument's sake, and 11% of all of our confirmed cases have ended up in the hospital. So we're bracing ourselves for about 160 cases or so, mostly on Oahu, going into the hospital. But if this month continues the way it's been, at 130 to 150 cases a day on average, that will be 4,000 cases, and it will mean about 500 or 600 people go to the hospital. That's when we end up seeing quite a different picture for the state, and some of the concerns that we've seen in New York, Texas, California, where they've overwhelmed their healthcare capacity. And that's really what we're fighting against. That's what we're trying very hard to stop. So I wanted people to understand that that was the overall real perspective. I know that a lot of people are saying to themselves, is this not just a bad flu? Is it really necessary to lock down in this way? It's definitely the toughest policy call I've ever seen. There may come a time in the future that we are able to educate ourselves to the point where we don't need to isolate, so that we can actually successfully stop the virus with masks and not through gatherings, not spread through gatherings. Also, if people are very senior, say over 80 or over 75, where the highest risks begin to occur, to provide a lot of extra support if we have the capacity. That's also pretty valuable. But these are the challenges that I've kind of seen in the last couple months. Meanwhile, the economic challenges are enormous. On July 31st, the federal subsidy ended. There appears to be a strong negotiation going on where we're told that the federal government will likely approve a $1,200 per person subsidy if you qualified previously under the threshold, the economic threshold. And that would also, they would also extend some of the unemployment bump, which had been $600 per week for individuals that were unemployed. They're now back at a negotiating point of $400 per week, but we just haven't seen the final number or agreement. It is a political season over in Washington, D.C., and I think that is definitely affecting things. Probably it'll mean it's more likely that there will be extra subsidy for all of our citizens that have need. Meanwhile, the state will continue its unemployment best of our ability. There's also going to be a subsidy of up to $500 per month for people who are housing unstable. And I know a lot of people on this call, and I want to thank you, actually. A lot of you guys are working on food insecurity, and that's an amazing thing. That's going to continue to, be a challenge, and probably will become greater throughout the fall until we ultimately see a drop off. The last things I'll comment on are vaccinations. I do have sources in DC that suggest that we will get to a vaccination toward the end of the calendar year, as many as 3 different companies. And I do have a special surprise for everybody as far as some expertise coming on board to share information with us later this month, which I'll share with you. It'll be pretty exciting. So I won't say anything more than that, but I will get a lot of extra information to us, and it's going to be a struggle. It'll be a year that we'll never forget, but we should come through this. As long as we don't tip over our capacity to care for people in the hospital before the vaccination comes, we'll get out okay. And please be as understanding as you can as we wrestle with having to have kids educated at home more often than we might like. And in some cases, businesses shuttered to a point that is pretty tough and intolerable for us. But all these things are meant to decrease suffering, and that's the approach that I'm trying to take. So why don't I stop there, if that's okay, James, so we can have more time for questions, and promise to answer questions more quickly than last time. So maybe kind of like a rapid fire dating question thing, so that I can get to everybody.
All right, so let's try and tackle some of these then. We'll spend some time with you here, and I appreciate the questions that are coming in. So we'll try and capture as many as we're able to here in the next 10 minutes or so. All right, so let's talk a little bit more about the exemptions, if you don't mind. How many exemptions are being allowed? The question is, how many exemptions are being allowed? And let's see, and why would these be an exemption at this time? So how many exemptions are being allowed? Are there any loopholes involved with this? Kind of that's what the question is being worded as.
Right. So no need for, that's a very good point. No need for an exemption until the quarantine goes back into effect, which will be on Tuesday. After that, people will have to get an exemption if they want to travel and not be subject to the 14-day quarantine. Really, the quarantine is meant more to protect the neighbor islands rather than to affect Oahu. But it is, in my understanding, is it goes both ways. When you return, you would want to essentially be exempted if you're an essential worker. And there are ways for you to isolate in a safe way. If you do go and travel between islands, we're hoping that people can get an exemption for health stuff. That's the main one. And in almost all circumstances, we approve it. As of last week, we had 49,000 requests for exemptions from across Hawaii and the globe. A lot of people asking for exemptions from the quarantine when they returned. Eventually, what we'll do is we'll be smart and we'll have a test 3 days after return, always. And we're hoping to have, forgive me, I'm sure this question is going to come up, but we're hoping to have, and I had this meeting with the team earlier today, a lot more inexpensive rapid tests from the category that's called nucleic acid amplification tests. These are, they include the PCR test, the one that's terrible deep into the nose, right? But they also will begin to include the saliva swabs inside the cheek. And they tended to cost $20 or $25 as opposed to $139 on insurance. Also means you could pay out of pocket much more conveniently. And some tests could come in even cheaper. Plus, we have some researchers here in Hawaii that have a technology that's similar to that, and they may get approved. So there's lots of good news on that front. But we'd like to have more testing because, let's say you're a school teacher, you're a firefighter, or you're a police officer, and you've been exposed, especially first responders, but I'll tell you, teachers are becoming first responders in my mind. If you're a first responder and someone has a fever or something, it's still probably a cold or the flu, but you might want to get a quick test rather than going through the 3-day cycle and going to the hospital. So I'm hoping to see a lot more of that.
Yeah, so you kind of hit that question a little bit about the rapid tests, the inexpensive rapid tests. How can we increase our capacity of those?
You can help me by writing the Department of Health, and if you don't mind, and if that's something that's of interest to you, writing Dr. Park or Dr. Anderson, I'll give you their emails. They'll love that. Let me see, what's their email? Because it's an important thing for us to do. So if you feel strongly about that, write to sarah.park@doh.hawaii.gov. Or you can write to Bruce Anderson, and Bruce is kind of a local boy for us, right? It's bruce.s.anderson@doh.hawaii.gov. And share that. We can do it by allowing some of these companies to come, because they've been getting emergency use authorization. They're pretty well demonstrated to be available. And there's a 6-state coalition that bound together, and they each bought 500,000 tests. I would love to have us buy 500,000 tests at a really low price point and have those tests whenever we needed them, to do more contact tracing and testing whenever we have, one of our organizations, one of our nonprofits, one of our schools that need testing.
Okay, thank you. Could we talk a little bit about contact tracing a little here? And in terms of, we have people in the community that want to be contact tracers and they want to help expand the program. How can they get involved, and how can we expand this program for the benefit of everyone?
Well, the first thing that we need to do is you need to lean heavily into the Department of Health. That has been a fail, if I may. It really has. They only had 15 full-time contact tracers effective like a couple days ago. They've had a bunch of people that were part-time, which is fine. And a lot of people would like to do that, but they have to accept that that is a way to enhance our army of contact tracers. We did offer them some support from the National Guard, by the way. 70 people can help them now. But if you guys, again, want to do that and you've gone through the course or you're a healthcare provider already, or you have that skill set, it would be very good. We've contact traced almost nobody in the last few weeks because the surplus of patients has been so gigantic on Oahu. They basically ran their resources into the ground. It would be good because we could stay ahead of it on the neighbor islands, especially Big Island, if we have even just like 30 or 40 people that are ready to go at a moment's notice. The number of cases we have would not overwhelm it. So if you write there, that's what you press for. Again, copy me if you think you're being ignored. That would work.
Thank you.
Yes.
Let's see. So this is more about, I'll read the question for you here. It's, how can I explain the importance of prevention measures to those who don't believe?
You might have to tie them up. It's possible. It's just amazing. They are starting a COVID hotline on Oahu, and it may be necessary, but honestly, calling law enforcement is really difficult because by the time you've had it out with somebody, they are gone, or they put a mask on briefly. So I can imagine Sherry can't bust them if it's gotten to that point. How can you explain it to them? One way to say it is, look, I care about you. Wearing a mask is a lot better than wearing a ventilator. You could say that. That is impactful. If people know that if they've got any family members that have lung disease, they will die if you spread COVID to them. So it's just a really serious situation. Most of the people that are catching and spreading it now are much younger, and so there's been a long-standing phenomenon in healthcare where young invincible people don't buy health insurance and they don't listen, and they don't wear seatbelts, that kind of stuff, right? And so these are the things that get you. In this particular case, though, it gets other people, and it's just very difficult. What you can do, though, is you lead by example. Don't participate in any gatherings more than 10 people. That's a strong recommendation from me. And so you can tell your significant others and other friends and family, like, look, I can't wait to see you, but we can't have a gathering of more than 10 people for a while until we get through this, and then it's okay. Spread stays very low if we do that. But if you're out and about and you see someone refusing to wear a mask and you try to tell them, I anticipate it's going to go badly. So I wish I had a better answer for that. You could pay them to do it, maybe.
Thank you. This question, we did talk with Representative Tarnas a little bit about this last time when the close of the legislative session. And it gets to the point of the difficulty of people trying to get by, right? So what about those that are working, but our food prices are getting harder and higher? So trying to make ends meet. They're looking for, assistance during this time, more assistance during this time.
It's very difficult because right now we had the opportunity, and I think it probably was a mistake, but we had the opportunity to enhance by at least $100 a month per person on unemployment, the unemployment benefit at the state level in this interval. The legislature appropriated that money, about $225 million, I think, and the governor line item vetoed that and holding that money back. He's trying to be super, super conservative financially. However, we have a back door, which is that we can actually borrow money from the federal government if it comes to that. And so I think probably I would prefer personally to have that money right now for people. It will all be spent. It'll keep the economy slightly more stimulated. And frankly, people are just buying essentials right now. We had some polling information that showed really large numbers. I think it was over 25% of people felt they could not afford essentials right at the moment. So it's pretty problematic. We will dig into that quickly if the federal government fails to pass any kind of boost in unemployment benefits. Then I think the state will come back and enhance it. So all I can say is I'm watching it day by day, and I'm communicating with Brian and Senator Schatz a whole lot, to see if the impasse is breaking. I think that it is, actually, and that'll get us through another couple months.
Thank you. And so kind of going back to about, the ICU beds are reaching half capacity. Okay, so there are a couple of questions here. There's one about our schools reopening and the safety with that. And then a secondary question about that's related to the capacity of our beds at this time is putting off elective surgeries, and if that's a good approach at this time as well.
Yes. Okay, so I've instructed the guys to begin to consider putting off elective surgeries again, and the threshold will certainly be no more than 70%. If we reach 70% of our capacity in our facilities, then we will have to then pull back on all elective procedures for a month. Of course, there are exceptions to that. If someone's getting an elective procedure, but they're in extreme pain, that I view that as a necessary procedure in that case. So just to be clear. So there is a threshold and we can expand, but we would pull back on electives before we'd expand services because it's difficult to expand the hospital beds. And even if you do expand the beds, you still have to have healthcare providers to staff them. So it can be challenging. As to schools, my gut tells me we're going to delay again for 2 weeks. I think, given this order today, at least on Oahu, it's probably not necessary at the moment. Neighbor Island risks are very, very low, but I know what people are thinking. They're saying, well, we don't test that much, and we could have extra cases out there that we're unaware of, asymptomatic individuals. Why risk spreading in the classroom to teachers? I'm more worried about teachers and parents than I am about children right now, because the disease manifestation has been so minimal in children that it's just not worrisome compared to the many other things that happen to our keiki. I think that we are definitely between a rock and a hard place right now because of the numbers of cases, and I think that we'll have to delay on Oahu. But it'll be the prerogative, I think, of the neighbor island communities if we decide that we're okay opening, especially because it's hard to get on with life if your kids are around the house all the time and you're working. It's just difficult, So I think that overall we would be safe. I don't think we have an adequate plan to test people in the classroom. That's a problem. So we'll have to be very understanding if we have outbreaks that classes get canceled and kids are able to be then home for 2 weeks. Pretty low risk right now on the neighbor islands.
Thank you for addressing those. This is kind of a follow-up to the rapid tests. The question is, what specific rapid test would you recommend?
Great question. So the Quidel rapid test is quite good, based on my reading. The rapid ACT test that came out of, that just slipped out of my brain, the name, I'll remember in a moment, had a slightly lower sensitivity. But a lot of the new tests are well up into the 90s, the 90th percentile and beyond, and they're really inexpensive. If you go and research NAAT test, the nucleic acid amplification test, those are the new ones that are cheap that can be used. They're now using them at the airports in Japan, for instance. Turnaround time less than 1 hour, and they work. The Quidel test is 16 minutes turnaround. It's perfectly good. Now, it's Abbott Act now, forgive me. So that was the test that a little less sensitive, but we do have on in our community hospitals to some degree. All of those work, but the antibody tests have tended to be very inaccurate. The antibody tests are usually the 1 drop of blood. We have not seen a good one yet. There are some mail-in tests that are going to be a 3-day turnaround. That's not any better than just getting a test at our facilities because it's still 3 days. So I think you're going to see a lot more rapid tests. And Oceanit is the company here that's making tests. They're about 2 months away, it looks like. And I have put in the face of Department of Health a lot of different opportunities for several different testing companies if they would like to decide to invest some of that money and bring rapid testing here. It's actually quite available. It's not perfect. It's not good if you are very sick and you're in the hospital, but it's more than adequate if you would like to get a quick assessment of, let's say you're a vice principal and you want to check 20 of your faculty, or if you have an office and instead of having everybody be out for a week to 10 days waiting for the test, you wanted to bring back people quickly because you have a big project. You could do it that way.
Thank you. And then going back to what you were stating earlier about gatherings of people and individuals, that kind of cap at 10 people. Is that a statewide order that's being implemented?
No, that's just the Oahu order. Each of the mayors has different standards, and I'd have to go back and look at the chart. They've tended to have slightly higher numbers, but I think it's foolhardy though, because one case, if you are in a group of 40 or 50 people, if you're just unlucky and you increase the probability of being unlucky when you have that many people, one case can spread to an entire group. That's how we had the spread at the McDonald's in Kona in the community. It was in Pacific Islander community there. And it's how we had the concern, of course, at Kona Hospital. They did have to say they did a pretty darn good job testing multiple times to weed out the cases. And now we're also doing testing for other health professionals before they come in the state. But that's a digression. I would stick with 10 just because it is way less likely to see large outbreaks. And we're very sensitive to that. And I know that Harry has a trigger finger to stop activities for Big Island. And so keeping spread to a minimum is a good idea right now.
So I don't want to keep you on too much longer. We've already been here with you for a little while, and I know you have other things to do and many other important things to take on. But maybe 2 more questions if you don't mind.
Sure.
All right. Let's see. So this kind of question is about the PUA, the unemployment. People are concerned that they still haven't gotten any. Where can they go for support and being able to get that assistance that they're looking for?
Yeah, that's been a frustration because the Department of Labor was not really equipped to manage a federal program that was put on the state. It just wasn't natural for them. Again, if you copy my Lieutenant Governor pages, we'll often try to chase it down. What I would probably recommend, I'm not trying to put a lot of extra work on your state reps or state senators. They're very good at that. I mean, I remember doing a lot of that when I was serving in the state Senate. And we have a staff built for knowing our local client, constituent, and going down to the Department of Labor and sorting it out. So I would probably immediately copy your rep or senator at each time and let them hunt down the applications. PUA it benefited some people. It wasn't a lot of money, but it was unique to small business owners, and that's a lot of what we do on Big Island. And you can definitely, my team we will go after them a little bit, but our volume of activity, unfortunately, is pretty big, and my staff is not giant. We have a total staff of 10. We're trying though. My heart's still with Big Island, although my role is a little different.
Thank you. So this last question I'm going to kind of combine two. They're a little more in my mind. I think they're a little more on the theoretical side about the part of the question is, how long can asymptomatic people spread the virus? And then once a person is exposed to a known case, how long should they wait for the incubation period before they go and get themselves tested?
Sure. So an asymptomatic person with the virus is likely maximally infectious for about 4 days. 2 days before the virus peaks in their body and 2 days after. But because you're asymptomatic, you don't know how long. The total period of illness is rarely over 14 days. And at that point, even if you are asymptomatic, your viral load has dropped so low that you're probably not a risk to almost anybody. Of course, if you're wearing a mask and someone's asymptomatic, you're just not going to catch it from them if you have, provided yourself some protection. If, however, you come across somebody and you're exposed, the average incubation period from when you're with them to when you get symptomatic is 5.2 days. And we are told that once you have the illness, it's like the 2 days before those symptoms begin, these are for symptomatic people, and 2 days after, that you are also at greatest risk to give it to your family member or friend. So if you catch the disease, if you catch COVID-19 and you're home isolating, but you have an apartment, or whatever, your small house, and you can't separate from your significant others, it's those days that you have to do your best. That window of opportunity. It's difficult because, obviously you're just getting the very minor symptoms at first, and then you don't even know, you probably haven't been tested yourself. But if you're really scared because you're with some guy and, they call you and say, turns out I was positive, that was COVID, then you're kind of on a calendar to 5 days. Once you're out beyond 9 days, if you've had that encounter, almost nobody ends up turning positive. Very rare.
Thank you, Lieutenant Governor. We've kept you here for about 35 minutes now, so I really appreciate your time. And is there any last words you'd like to say and impart with us before we move on this evening?
Well, first, thank you for indulging me and giving me so much time. You've got to realize you've done extraordinarily well. I mean, it is completely unbelievable that, knock wood, we haven't had significant fatalities on our island. It's amazing that we have so few cases, and people are actually, they've been very resilient. But I know it will take its toll psychologically and financially also. So completely aware of that. My recommendation would be keep doing what you're doing. If we can encourage people to not gather more than 10 people and encourage more people to wear masks, you can start normalizing and having as much activity as normal as possible without tourism. That is a way to do it, and we can have our lives. It is going to be a very tough fiscal year, so I'll be advocating to take on some additional debt for the state of Hawaii to get us through without having to have a lot of people leave. I think it's probably prudent to do that, because I also believe that tourism is going to come raging back once the virus is finished. That's every indication is that that's what's going to happen from around the world. So I do think that we're going to have a booming economy like 9 to 12 months from now, but that's a long time to wait. So I think we can buy some time with some prudent borrowing, which is at 1%, and the activity that we're able to sustain in our community. Nothing's perfect. This is a very unusual time, but I don't want people to be worried about being hungry or not be able to pay their rent. So those are the priorities, and I'm just grateful that you included me, and I hope it was okay.
Absolutely. That was all right. Yes. Thank you for your time, Lieutenant Governor. It's great to have you on here again. Really appreciate your commitment to the community and spending time with us this evening. We know you're very busy at this time, so we're grateful that you could share some of your time with us this evening.
Thank you, guys. Thanks for including me. Sure. See you guys.
All the best to you, Lieutenant Governor. Mahalo nui.
Mahalo. Take care.
Okay. Before we move on to this next portion of our meeting this evening, I just wanted to pass on the heartfelt condolences from the Waimea Community Association to Dr. Gary Goldberg's family at this time. We recently lost Dr. Goldberg very suddenly. He was a chief medical officer here at North Hawaii Community Hospital. And he actually joined us back in March at one of our committee meetings before we decided to go virtual. And he was talking about and discussing with us the preparedness as we entered this time of COVID. So I just wanted to pass along our condolences from the Waimea Community Association to his family. All the best to them. Mahalo. And at this time, I would like to welcome Captain Sherry Bird to the floor so that she can give us a kind of updates, community policing report update. So Captain Bird, the floor is yours when you're ready. And thanks again for joining us. We really appreciate you being here on a regular basis with us. Thank you, Captain Bird.
My pleasure. Good evening, everybody. Going over some district crime stats for July. Let's see. I'm happy to report. Actually, we had no robberies. We had no burglaries. We had no car thefts and no vehicle break-ins. So as a captain, I'm pretty stoked about that. And it's a decrease from the month prior. As far as accidents, we did have a decrease in the major accidents as well. We went from 9 in June to 6 in July. Slight increase in the minor traffic accidents from 13 in June to 16 in July. And then the contributing factors, speed, inattention, and misjudgment. So just asking everybody to please continue to drive safe. We got a social distance. We can social distance our cars too, leave enough distance between you and the next car and be aware of those other cars around you. And DUI arrests, slight increase as well. We had 10 DUI arrests in July, and 2 of those drivers were under the age of 21. For our district, for the past several months, we've had 2 sergeant vacancies, 2 sergeants retired. So that left us a little short there. but happy to report that on August 1st, we welcomed 2 new sergeants, Thomas Chungmin and a Braden Kimura. They bring with them a lot of work experience, a lot of enthusiasm, and they're very both looking forward to working with the community. Since we're on the COVID conversation, I wanted to talk a little bit about COVID in our district. You know, we all saw the news and we know there's recent positive tests with some of our partners that we work closely with. So for us, it brings a lot more realism to the forefront for us in South Kohala. And we want everybody to be protected, and this includes the officers and staff. So I just wanted to remind everyone that facial coverings are required when out in public, and this includes if you're visiting our police stations. We have hand sanitizer stations in our lobby, and we've limited the amount of people who are allowed in the lobby area at one time. We are still continuing with police services, of course. So if you do need police services, if you have an emergency, you know, of course, call 911. If it's not an emergency, please call our non-emergency dispatch number, and officers can be sent to your location. And should you have interaction with police, just be aware that officers responding to calls for service as much as possible, they're going to be also taking protective measures. For example, at traffic accident investigations or traffic stops, where officers need to verify documents such as driver's licenses, insurance cards, etc. You may be asked to hold your own documents while they verify that information. We want to minimize the touching of the documents. And when officers are taking reports, if you're in an enclosed space, the officers might ask you to step outside so they can get the information they need for their report. Bottom line is we want everyone to be safe as possible. And I, like everybody else, ask everybody to please abide by the rules that are currently in effect. And that's all I have. Please stay healthy, everybody.
Thank you, Captain Bird. I appreciate you taking the time to address your community. Thank you for joining us again. For this next portion, I'm just going to take a little time here myself, actually, and present some information about the Hawaii State primary election. Just I'm going to take a moment here, which will be decided this coming weekend, actually. So first off, the State of Hawaii primary election on Saturday, August 8th, is a critical day in our elections process, and many of the competitive seats will be determined in the primary. And if candidates, especially those nonpartisan, receive more than 50% of the tallied votes, they will be elected that evening. All registered voters should have received their mail ballot packets by now. And if you wanted to mail back your voted ballot for Saturday's election, it was recommended that you post your ballot packet in the mail by this past Monday, August 3rd, for it to be received by the Office of Elections by 7 p.m. this Saturday. So if, however, you still intend to vote in the primary election, there still is time for your ballot to be counted. And for one way for you to do this, since you have possibly missed the opportunity through the post, the USPS, you can drop off your voted ballot packet at one of the designated places of deposit. And so here in Waimea, we were fortunate to have one of these drop boxes, and it can be found right outside our Waimea police station. And these 10 bins are located at distinct locations across Hawaii County. And you may also visit the voter service centers, either Aupuni Center in Hilo or the West Hawaii Civic Center in Kona, if you have questions about voting, you need to register to vote, or you're dropping off your voted ballot packet, or even if you'd like to vote in person. So more details and information about voting this year in this vote by mail year and in Saturday's primary election can be found on the Office of Elections website. And we have also included much of this important information on the Waimea Community Association website at waimeatown.org. So we have put up some information there. Oh, thank you for letting me have a moment there to talk about that. And so for this next portion of tonight's meeting, we'll be hearing from a number of individuals representing groups and organizations that have been working hard to support and feed our families and communities during this difficult time. You may be familiar with many of these groups and the work that they have done and are doing to care for our neighbors, our friends, and families, while also supporting many businesses across our district and island. With the challenges presented by COVID-19, the effort carried out by these organizations have been a lifeline for many families and community members. And we are grateful for these individuals and their organizations' tireless work and dedication. The Waimea Community Association Board wanted to provide you, our viewers and members, an opportunity to learn about the care and support provided by these organizations for the overall well-being of our communities. So to begin this portion, this update portion, I would like to welcome Ann Lum with Annunciation Catholic Church Food Pantry. Ann, the floor is yours to present your updates.
Thank you, James. I'm Ann Lum, the coordinator of the Community Food Pantry at Annunciation Church. I've been in that position for about 13 years now. This has been a challenge, as it has to all of us. We went from an average of 65 food boxes a week out to people with a sign-in process, 1 box a month, knowing their names and how many people in their families, and anything they want to share with us, but we never have required a lot of information from them. That really wasn't our business. We are now currently giving out about 165, 170 boxes a week. And we accompany that with each box gets a bag of vegetables that we've obtained, that have been donated to us or that we have bought from local farmers. We are taking part, blessed to be a part of the KEC of food to families, I think it's called, something, they're vegetable. And we also have some money on the Bridges loan at the Farm Bureau that we're taking advantage of. So that has been a joy to be able to give beautiful, beautiful fresh vegetables to our clients. The shelf-stable food is the usual rice, some canned goods and so on, cereal. Also we have from St. James their leftovers sometimes too, so thank you, Tim. Anyway, we have drive-up only, except for we do have a special place for walk-ups. Some are homeless and people that don't have transportation, some bicycles. And we do that's a little tricky on the social distancing and the masks. We do have some masks we give out, but that's been working there. About 8, maybe 7, 8, 9, 10 people. The drive-up, we wear masks, people stay in the car. We have hand sanitizer out. I'm very, very careful with our volunteers. The 10 number is hard. We keep 2 people outside for traffic. Traffic lines up. We can get 28 cars in the before we are forced to open up. So we've been opening up 15, 20 minutes early. Do maybe 100 boxes in the first 45 minutes. It runs pretty smoothly. We build boxes on Saturday. I'm over there at the church hall 9 to 11 every Saturday. They're building boxes, but I'm also there to receive any donations, financial or food, actually. And then we do vegetables on Monday afternoon. It's a busy place. We do try to keep the volunteer total to around 10, including a couple that are always outside. So that's working. We have given out 2,000 boxes from May, June, July, the last 3 months. A box is for 3 to 4 people for 9 meals, 3 days. So that's like 54,000 meals or something like that. It's incredible. I will tell you that the end of June, I will say I mean we, were 30% beyond our yearly budget. We keep providing food. I will tell you there's no money there. I just got word today, we had applied for one of the CARES grants. I got word we were turned down because we didn't ask for enough money. I didn't realize there was a $250,000 minimum. So we were turned down because we only asked for $120,000. I have to look at Plan B. There is no Plan B. I'm having a hard day. I'm looking at the specter of having to close. So if anybody knows of money that we can apply for a grant, I have a grant already to go. It's pretty emotional. The people are really, really grateful. They're very needy. They're thankful. They're happy with the food. They're delighted with the vegetables. I had somebody ask for kale Tuesday. There are people that we know and people that we don't know, people that maybe come every week or every other week. We're not restricting anybody. We figure if you're in line at a food pantry to get food, you need food. If you need it because you're scared, you still need food. We have people giving us back extra cereal now, so you know they don't need 4 back boxes of Cheerios. We're thankful to Keck, the bridges. We did have some money from Richard Smart Fund. I'm burning money. You know, we're spending $3,000 a week on food, and the vegetables are coming from Keck and from the bridges money. I wanted to, in the grant, I asked money to continue that, buying from farmers at the end of August when Keck's program ends. We didn't get it, as I say. So I want to thank all of you for all of us and all of our volunteers for all that we do. It's a good thing to be doing. We just have to be able to keep it up. Thank you.
Thank you, Ann. Appreciate your time and sharing with us this evening. Thank you. Next, I would like to welcome Nancy Carr Smith with Big Island Giving Tree. And Nancy is also one of our Waimea Community Association board members. Nancy, the floor is yours.
Thank you. Aloha, everyone. Thanks for the opportunity to be here tonight. On behalf of my partner, Rhonda Bell, who's the heart of the Big Island Giving Tree, I'd like to share a summary that she wrote that will give you an idea of what we've been up to during these challenging times. The Big Island Giving Tree is an all-volunteer nonprofit organization that assists family, kupuna, and houseless year-round on Hawaiʻi Island. We're a boots-on-the-ground kind of organization who responds immediately when there's a need, disaster, or crisis that affects our community. Every month we do outreach for the residents of Pahoa and Ocean View. Volunteers set up giveaway sites with gently used clean clothing, bedding, housewares, cleaning products, basic needs, and more. In Ocean View, where resources are very limited, we also have been providing a one-time emergency food bag for those in need. We also pick up USDA fresh produce boxes for 8 weeks straight in the month of May and June. In the months of July and August, we'll pick up 3 times each month. These boxes are distributed to rural communities where we create a no-contact drive-through distribution. In addition to the fresh produce boxes, we add fresh eggs, ground beef, milk, bread, and sometimes poi. All items are bought with funds donated by generous donors in our community. Some of the ground beef is donated by Punaholo Ranch. Other beef came from the Bridges program Tim Richards helped create. We've rotated between communities and coordination of distributions depending on what other distributions are happening in those areas. We partnered with Ippy's Hawaiian Barbecue and Waimea to feed kupuna a hot meal each week. Tuesdays and Thursdays, Ippy cooks up meals that are delivered to the doorsteps of our Waimea kupuna by volunteers. All this is made possible by a Richard Smart Fund of Hawaii Community Foundation and the generosity of Ippy, his family, and many volunteers. In Kohala, Big Island Giving Tree has partnered with Feed Kohala initiative. We hui together to feed the kupuna and families in Kohala. Each week, Feed Kohala cooks 3 meals for kupuna, and Big Island Giving Tree delivers these. We're hopeful that Feed Kohala will be awarded some of the same care funds grant that Ann spoke of. If we do receive part of this grant, we have a plan in place to continue feeding kupuna in both Waimea and Kohala, also providing 150 family-style cooked meals each week. In Kohala, rotating 300 families. Sorry. Didn't mean to do that. Yeah, so that's Feed Kohala. We work closely with Hope Services Hawaii to help families and individuals who are on the verge of homelessness and those who are transitioning to housing. We've bought furniture and houseware needed to help families feel at home in their new place, stock their cabinets, fridge, and freezer to help start them off. Under normal circumstances prior to COVID, we encourage our young people to get involved and be generous with their time to volunteer. One of our goals is to create stronger families with caring young people so that we're able to see a positive shift in our society. Our organization has seen countless families return once they're back on their feet to help someone else give back to to help give back to some other family. God has truly provided for Big Island Giving Tree with all the provisions needed to do each task that's set before us. We're thankful for the many partnerships that we've created on our island, which helps us to be the best we can be. We cannot thank our generous donors enough. For deepest gratitude for our many faithful, reliable, trustworthy volunteers who help us along the way and who are so generous with their time. Thank you for the opportunity to share what we're doing.
Thank you, Nancy. I appreciate that update there. Next, I'd like to welcome Kristin Frost-Albrecht with Hawaii Food Basket. Kristin, the floor is yours when you're ready.
Hi, everyone. I'm Kristin Frost-Albrecht. I'm the Executive Director of the Food Basket, Hawaiʻi Island's food bank. We have offices and warehouses in both Kona and Hilo, and we do serve the entire island. We have an amazing network of food pantries and soup kitchens and after-school programs, and just a tremendous group. Some of you are on this call too. We've had, like hearing from Ann and Nancy, it's been quite the time. We're a high touch, high hug business, and we've gone to a no touch business. And that's been really tough. We are doing a tremendous amount of direct service at this time. A lot of our pantries are run by elderly volunteers who don't have the ability to provide a drive-through sort of situation. So we've pivoted to start doing more and more direct service. Starting at the end of March, we began doing about 14 to 15 ohana drops, we call them, across the island in communities, where we see anywhere from 1,000 to 3,500 individuals at a time in a drive-through fashion. This is a lot more logistics than we've ever probably had to do at the Food Basket. And we've been fortunate enough to have the support of the County of Hawaii, the Sheriff's Department, the police, and the National Guard and CERT teams, among tons of great volunteers. So I think it's amazing what we are all doing together. We also do emergency food boxes from our warehouses in both Kona and Hilo. And those food boxes typically that we are giving out we try and do 14 days of food if we have the supplies. We've definitely had supply issues this year, especially with the federal food that typically makes its way to us. That has not been coming through. We are purchasing nearly all of our food. We're spending about $400,000 a month to distribute the food that we are distributing. We also do home delivery for at-risk or health-compromised individuals, those who might be in quarantine or have limited transportation. We've started a partnership back in March, actually, with restaurants to create frozen, ready-to-eat meals for distribution. Those go out typically through our ohana drops. We too have been amazing recipients of the Bridges program. I was so happy to see that you were reporting up here. That's been a wonderful program. And we've partnered also with the likes of Parker Ranch and the Hilo Fish Company, Sui-san and Hawaii Food Service Alliance. We have a partnership with them where we do a USDA Farm to Family food box program of protein. It's 20 pounds of protein that we distribute, and also milk. So those are typically also going out through our ohana drops. I just have to say that we've had tremendous philanthropic and community support. Hawaii Community Foundation has been truly amazing. They started out with us during lava, and I feel like they are right there next to us, lock in step, as I'm sure all of you have felt too. Probably the most astounding number I can give you is that when we finally had a chance to catch our breath and catch up with our numbers, is that we are serving over 80,000 individuals a month. That's a month. In pre-COVID times, we thought we were serving a lot at 14,000 individuals a month. That's more than 5 times what we were serving. So my heart goes out to all of you. You guys are doing amazing, amazing work, and I thank you so much. If the food basket can help any of you, please don't hesitate to call us. My cell phone number is 430-2554. You're always welcome to give me a call. And we'd like to help in any way we can. Food insecurity is a real issue right now.
Thank you so much, Kristin. Appreciate that. At this point, our next guest, I'd like to welcome Tim Bostock. Excuse me, sorry. Before I jump to Tim, I apologize. So jump in my list here. I'd like to welcome Laurie Ainslie with Kokua Christian Ministries Food Pantry. Sorry about that. So Laurie, the floor is yours when you're ready. When you're ready to unmute yourself, please go right ahead.
Thank you. Thanks, James. Thanks, Waimea Community Association. And good evening, everybody. We're excited to be here and be able to talk about our organization. We're a nonprofit, all-volunteer group that's been in our community for over 10 years. We rent a small home from Emila Church, so we're right on Church Row. Pre-COVID, we did emergency box distributions, hot meals, showers, hygiene packets. What's changed is obviously no showers, everybody's staying outside, and no hugs, no love. As much as we can give outside the door, we try, but a lot of things have changed. But what hasn't changed is the need. It's grown tremendously. We've doubled in all areas. We've doubled in the number of families that we are providing boxes to. We are doubling in the number of individuals. An interesting statistic that we found is that the new families that are coming, we've had over 250 new families in 3 months participate at the pantry. Those new families are bigger. So it's it's actually a different demographic group than we've seen before. Large families with a lot of need, lots of kids. And we've doubled the hot meals that we've been doing. So we serve on average for the first quarter of this year, we served on average 137 families. We do limit families. We've had to limit families for budget reasons to once a month. So these are different families, right? We know these are different households. And then, and we are now doing twice that. We're doing about 316 we averaged individuals we were taking care of. We're doing over twice that, about 750 to 800 a month now. And our meals have doubled from 80 hot meals every Wednesday to about 148 on average. So the need is tremendous. We've had incredible support from Hirabar Farms Forever, from Keck's program, Farm to Families, Hawaiʻi Community Foundation, individuals in the community. We had a young woman who's just started a business here in Waimea. She brought us half of her stimulus check as a donation. And honestly, emotions run high, right? And we almost all cried in the pantry. We just couldn't believe it when we opened up that check. So, people know we're here. People drop off fruit. People drop off anything, cookies, whatever. And I just really encourage everyone, whatever you can do, just a little bit really helps. Everyone is so appreciative, and especially the new families are in situations where they have never had to ask for help before. So the most important thing is that when you look in their eyes, you let them know that, but for the grace of God, it could be any one of us in any situation. So I understand Anne's emotions and thinking that potentially you can't help people. We are fortunate enough to have received funding that we now are expanding and allowing families to come 2 times a month. We hope to be able to do that as long as we can, but our business model has changed. We are an agency under the food basket, and so appreciative of that partnership that we've had for so many years. But as Kristin said, their business model is changing as well. They are running out of food. They do not have the supplies that they can provide us. So we are now buying our food retail direct from Costco and Foodland and KTA. So the business model, like everyone's business model, ours has been turned upside down. But we'll keep doing it as long as we can. We're trying to be smart about how we do it so we can take care of people for the long run. We anticipate it getting a lot worse before it gets better. Thank you.
Mahalo, Laurie. Appreciate that. Thank you. So at this point, I would like to welcome our next guest, Tim Bostock with the Waimea Community Meal. Tim, the floor is yours when you're ready.
Thank you so much. Thank you, Jane. It's an honor to be in this esteemed crowd. Hi, everybody. The Waimea Community Meal started 4 years ago and was essentially a gathering, and we flipped it all around in March. And we have, as everybody else, we've about doubled. We've served 640 people average over the last few weeks. It spiked a couple of times, just over 700, but then dropped again. We are also now running the Pawilo Community Meal, which is at St. Columba's Church. We cook the meal at St. James, which has a functional kitchen, which St. Columba's does not. And we take it down there. That grew from 100 to 400 very fast, and we're now averaging about 450. So an average of about 1,100 meals a week, but 1,200 we've exceeded a couple of times. And for that, maybe 4,500 meals a month, we are spending through the roof, about 10,000 a month, which freaks me out. But then I also look at the report of our donations received on a weekly and a monthly basis, and we are keeping track. We have our church has grown a lot in the last several years. We have a lot of donations from the mainland, actually, from visitors who have come to the church on a regular basis, snowbirds, but their main home is mainland. We have had some significant grants and gifts from families in that position, which has really helped. We get really small gifts as well. Most of our gifts come online, some checks in the mail. And of course, our sponsorship program, which we started a couple of years ago, has really, really helped us. We had a sponsorship amount of $600, which would buy the food we needed to feed about 350 people a week. That was sort of our average before COVID. We now double that. So we're not asking for sponsors to give us $1,200. We're just looking for 2 sponsors every week. And that's been working. So the $1,200, it kind of covers the cost of food. But as I just said, we're spending up to $10,000 a month because our equipment and some of the basic logistics we need to actually do this, we've really had to explode. The rice cookers, the roasters, the warmers, the wagons, the coolers. So that's been particularly this last month. It's going to carry on into next month a bit. We're tooling up, and we have a lot more capacity than we did. We still do have, wonderfully, volunteers coming at all times during the week, helping us with chopping often the day before and prepping and cooking the day of. And we're not lacking in volunteers, but I do worry about the money. And I mean, when I looked at last month, the money we received was mostly sponsorship for meals we have yet to cook, right? So that kind of means that it's a bit of a Ponzi scheme, right? We're running on a, we can't stop. So I think it's working. The vestry of St. James has an overview of the whole budget. St. James, it's not a separate, entity from St. James. It is run by St. James and underwritten by St. James. I think if we were just doing the Waimea meal, I would be comfortable that we had enough support to keep it rolling. But the Pawilo meal has been expensive, I have to say, and we get much less support directly from the Pawilo community at the moment. I have been writing some grants and having success. The Healy Foundation, the Richard Smart Foundation, Hawaiʻi Community Foundation has been extraordinary, very helpful. I'm actually trying to write grants now for 2 big capital projects. One is to rebuild or renovate the kitchen at St. Columba's in Pawilo so that we can actually generate the meals there. Looking for about 280,000, and we have about 150,000 so far. So that's rolling quite well. And the other is to rebuild our pavilion so that that can be a full commercial kitchen and a gathering space when there is a post-COVID. And that could be used for many other community uses. We hope we might embrace a Christian ministry in that new home eventually in a couple of years. So that we see as more like a $3 million project, and we have a $1 million donation towards it already. So we're kind of moving on those two big capital projects, kind of parallel to keeping up the operation. Tonight was actually a slower night. We served just over 605 people. That's a bit slower for us. I don't know about you guys, Anne and Laurie, you're probably the same. You see a rush at the beginning, right? There's always that rush and that wait. And Anne, you were saying you have to open early. We've done very creative things with managing our traffic line. We don't want the cars to back out onto the highway. So we have them do a kind of figure-8 loop around the front lawn and then tighten up along the circle. We can accommodate about 58 to 60 cars before we have to open. And really, most of the action is in the first half an hour or 45 minutes. We do stay open, though, for 4:30 to 6, and we often do have some late people coming in just towards the end. We have not yet run out of food, and I don't honestly know why. But we are happy with what we're doing. We're happy that we're building the Puilo Community Meal. We have a vision that the Puilo Community Meal will support itself probably in a year or so. With its own kitchen and with its own volunteers, and we what else to say? Don't know. We don't know how. Oh, I wrote some notes. Here we go. Who are our guests? We have elderly, single, and couples, families, often large, 7 to 10 people. We have maybe 150 plus keiki that are being taken meals to. Meals are being picked up for, because we also do a keiki craft. So we ask every car, do you have keiki at home? And then we give them a keiki craft kit. You know, I gotta say this, we have a much more mixed race, mixed background in our guests, in our drive-through guests than we used to have. We used to be we skewed more elderly, and we skewed more towards our congregation because it was about combating loneliness as well as food needs. But now I think we mirror Waimea's diversity better. In our guests. We have homeless walkthroughs, maybe, I think we had 12 was our max, but you know, about 8 to 10 usually. In addition, we're taking down to the beaches, but there are slightly less homeless camps on the beaches at the moment. I think we're looking at about 20, Richard took down today. And then some young couples, some young singles, and I agree with you, Laurie, it's families that didn't ask for help before. They're not used to it. I have one family, last story, I have one family that comes in a van, older aunties collecting for the wider family. They pick up 15 meals, and they every week, without fail, give me $10. And it's on that kind of helping each other that we keep rolling and that we're keeping open. Aloha.
Mahalo, Tim. I appreciate your stories there and all that you do. Thank you. Our next guest, I'd like to welcome Elly Mercer with Waimea Preservation Association and their Grab and Go meal program. So Elly, the floor is yours. You have make sure unmute yourself there, and then you'll be good to go.
Aloha, hi everyone. Just like you guys, our meal service is for the community, by the community. We have approached several of the restaurants to help us actually. So we asked them to make us a small meal that we can give to our drive-through guests every Monday and Friday at 4:30. And we do this at the Manuku'oli Park behind Foodland. We've had great success with it. We feed about 200 to 225 people every Monday and Friday. We survive on donations and on grants from the community. We've had grants from the 100 Women in North Hawaii Who Care, from KEC, from Hawaii County, from the LGA Foundation and the HAPA grant. So they're so helpful, and we're so grateful for everybody's help and contribution to us and helping our communities. A lot of small businesses have chimed in and helped us too. And the police department was directing traffic and handing out food for us the other day and talking to everybody. It was really nice. We started this program in 2017, but we've seen things morph and change during COVID into something a little more different, where we're supporting the restaurants just as much as the restaurants are supporting our communities. So we have about 12 volunteers now, and it's all volunteer based. Restaurants like Tropics Ale House have really been supportive. And the Noodle Club, Fish and the Hog, everybody's coming together in our community. And just like the rest of these programs on here today, it's all our community coming together to support each other during this COVID and hopefully beyond. We thought we were gonna have to shut down here in September, but we got another grant. Hopefully something will be coming through for us tomorrow. So it's day by day, and people that drive through our line also volunteer and come back the next day with donations sometimes, and their time. They donate their time a lot. So we would like to thank the Noodle Club and Fish and the Hog, Jade Palace, Young's, Aloha Bowl, Ippies, and Earl's as far as the restaurants. Also, the bakeries are donating to us. Mamane and KTA and Foodland Bakeries all give us food that we give out with those small meals. A lot of farmers drop off fruits and veggies that we give out every day. We try to give more than we can, you know. So it's a little bit hard, but it's coming together. It's making a great program, and we feel like we're doing something good for our community through volunteers. And we want to invite everybody to come through our drive-through, say hi, volunteer if you want, and donate if you can. But it's really out there for everyone in the community to enjoy and come together. Thank you all so much.
Mahalo, Elly. Appreciate that. For our next two presenters, we're going to highlight some of the extended work that's happening, much of it behind the scenes, that support our local farmers, our ranchers, and our businesses, and in turn to support some, and if not all of the groups that you've just heard from that have just shared with us. So first, I'd like to welcome Laurie Farrell with the Bridges program. The floor is yours, Laurie.
Aloha. So we're Bridges. We're the same program that Ann mentioned and Kristin did with the Hawaii Food Basket. Of course, the Hawaii Food Basket is one of our largest partners. What is Bridges? We're bridging the gaps created during COVID-19 for the disruption from the Hawaii agriculture producers and the community. What we did is we support local agricultural production by purchasing local grown products that are delivered to approved community organizations for island-wide distributions. So you don't see us in the community actually distributing the food. We purchase the products from our farmers at a wholesale price because we need to keep them farming because we can't have a disrupted food supply when all of this goes somewhat back to normal, or at least that's our hope. And then we then in turn have those products delivered to the organizations, and then they distribute it. So they're the faces the community sees. So we're happy with that program, and it works well. How did we do it? We removed the red tape. We utilized a simple sign-up system, which is semi-automated, and that kind of cut down our workload. The project is administered by the Hawaii Farm Bureau. We're fully run by volunteers at this point. The Farm Bureau is not charging us any administration fee for that service. We began with an original amount of $200,000, which we have pretty much expended at this point. We are seeking additional funding to take that through the end of this year, and we're talking to other organizations on Oahu about possibly expanding this model statewide. It's working that well. Our mission, of course, like I said, is to preserve the local food chain with as little disruption as possible. So what have we bought? We bought 16,525 pounds of papaya. We did 36,530 pounds of local grass-fed beef in various forms, 1,145 pounds of bananas, and 15,500 pounds of head cabbage. And then in addition, another 6,000 plus pounds of avocados, lettuce, tomatoes, goat cheese, honey, coffee, all types of products, but all locally grown. So we're hoping to continue this through the end of the year. Like we said, we don't have any word on the funding that we've looked at, but we are hopeful. And I think that there's a good outlook that this will definitely continue. Who have we helped? Of course, the Hawaii Food Basket, the Ohana Food Drops, Feed the People in Puna. So our products are sent island-wide. It's not any one specific community. Any organization can ask us for help, and then the committee approves them. So if any of you are needing help and we haven't heard from you, by all means, reach out. Like I said, we are expecting additional funding. What's next? Like I said, we're seeking new funding. Donations, of course, are accepted. Our project model, it's working. Originally, we thought we'd buy more fruits and vegetables than proteins, and it's turned the other way. The need is in the proteins, and thankfully, our ranchers are growing proteins, so we have great access to that. So it's been really good because the small ranchers are taking advantage of this. It's keeping them in business, and it has made a difference on both ends of the spectrum. So we're fighting really hard to continue this program. We probably will continue with a private-public partnership. In addition, we're probably going to have to work on some more administration work. Not sure Randy and I want to do it all or can do it all if we continue to expand, but we'll keep holding it together, and Farm Bureau is going to continue to support it as our other community partners. So we're thankful for the people that have taken advantage of it, and we hope to continue.
Mahalo, Laurie. Appreciate that and your time and effort with the Bridges program. Thank you. Our next guest is Leslie Kissner with Farm to Families. And Leslie, when you're ready, you can unmute yourself, and the floor is yours.
Aloha, everybody. I'm Leslie Kissner, and I'm actually executive assistant at Keck Observatory in Waimea. About 5 months ago, my boss permitted me to do something entirely different, which is being chair of our Farm to Families initiative. And what we've been doing is purchasing produce from local farmers in both Waimea and Honoka'a, and then delivering produce with our Keck vehicles and our staff to a number of programs in Honoka'a, in Waimea, and also in North Hawaii. And we've purchased a couple of other unique things. We've worked with the Hawaii Ulu Cooperative in South Kona and purchased some ulu and donated that. We also got an idea, actually, Tim, through Sue Dela Cruz at St. James to purchase a hog from a 4-H student who had raised a hog, and then of course, because of COVID, the auction and summer show was canceled. And so we purchased it from her and had it delivered to Kulana Foods to be harvested and processed, and then dropped off at St. James to serve as Kalua pig. So we've tried a lot of different kinds of ways to feed our community. We've also provided some funding for a few of the programs here, like Bridges, and also Umeke'ai, which is the Hawaiian Homestead Program. And I have to say that this has been one of the most rewarding things that I have done at Keck, and it has been wonderful to meet all of you and all of the volunteers that are very inspiring working in our community. We are on track to expend our funds the end of this month. And so I'm really hoping that some of the CARES money that's becoming available now in our community. I was told it was $8 million on this island. I don't know if that's accurate, but I'm really hoping that some of that funding is going to be able to pick up purchasing of our local farm produce. As many of you know, a lot of the farmers lost business when COVID hit and they were no longer able to sell to restaurants and hotels. So with that, I'll say thank you to all of you volunteers, and thanks for having us be a part of this.
Mahalo, Leslie. Thank you so much. So we've now heard, just a little bit about these groups and organizations that are striving to support our families and communities during this time. And we are grateful to all the program leaders for joining our meeting tonight to share out. And we hope these updates provide you a glimpse into the work being carried out across Waimea, North Hawaii, and Hawaiʻi Island. So please reach out to these groups if you have any follow-up questions, or if you are looking to assist them in any capacity in their effort or their outreach. So thank you, Anne, Nancy, Kristin, Laurie, Tim, Elly, Lorie, and Leslie for your time and leadership during this challenging period. Mahalo nui. Before we close tonight's meeting, I just want to make a couple of announcements. First of all, mahalo nui to all the presenters for joining us tonight and for taking the time to update our community. Going forward, we still plan to hold our monthly town meetings on the first Thursday of the month. And at this time, they will still be in a virtual setting. Our next scheduled meeting is Thursday, September 3rd. And we're planning to have more discussion about COVID-19, especially as it relates to our local businesses and the resort communities. But we will keep you informed about the details and specifics. Thank you all to the viewers for joining us on the live stream. You are welcome to revisit and rewatch this recording on the Waimea Community Association Facebook page or up on the WCA YouTube channel, which we put up towards the end of this week here, at the end of the week. And on behalf of the Waimea Community Association Board, I wish you good health, be well, aloha.